Greetings on this beautiful sunny day in Auckland. Thanks for the opportunity for this challenge. The health industry in New Zealand is very fragmented currently, with some clinics being up to date with their practice systems, and some are using data in the cloud with bookings, and some even use virtual consultations online. But many are still in the rural areas, and the small clinics especially are using PCs that are not even networked, and in some cases standalone with their data locally and possibly not even secure. So many of the small rural practices especially have never used a teleconferencing system before to connect with their patients, and this would certainly save the elderly and very sick patients from having to drive long distances or being driven by somebody else. And so currently a large percentage of the patients waste their time on travel and sitting in waiting rooms for fairly minor checkups and symptoms. And many, especially the elderly, would visit their GP or their hospital on a regular basis. And these patients in particular could be handled much more quickly and effectively on a remote call in the comfort of their own home. There's also patients who are living on the edge with bad hearts and other issues, and sometimes don't make it to the GP or the hospital because of these issues becoming acute, and realizing there's more serious problems they don't make it, unfortunately. So the solution we have in mind, we've got a CareANZ practice management solution, which is 95% complete. At the moment, there's only about 3 in New Zealand that support about 85% of the clinics with their systems. But many of these solutions are out of date or not efficient and difficult to use, as we've been told by some of the doctors. CareANZ has a new PMS solution with video calling and some extra features which we'd like to expand upon with some extra funding. The impact, very few tech providers at the moment, if any, are providing equipment or smartwatches which would allow to monitor the health of some of these patients remotely. And so with some extra funding, we'd like to develop these modules further. We've already got experience in this space with another company who has biometric wearable gear in the workforce wellness area. And certainly I've used watches myself and some of these wearable equipment, and we can monitor the data online. So symptoms and health issues can become more acute. Wearable gear and a smartwatch would alert the user or the carer or the family members to issues, and they could then organise a virtual call with their GP, or certainly if it's more serious, call 111. Potential customers, we can certainly cover the whole of the country in New Zealand or Australia. So anyone in New Zealand could download the app for free, and the doctors could certainly trial the system for free for a period of time. And the patients can then obviously contact the doctors or the hospital once they're registered with the CareANZ system. And if they have a unique or acute health issue, they can have a virtual call through the CareANZ solution, and possibly even with the specialists once they're registered with the CareANZ system as well. We look forward to talking to you further. Thank you.